Hey, I want to welcome our viewers to Kennesaw Happenings podcast. I'm Golfer Pete, and we have a couple in the studio. The most interesting concept I've seen in a long, long time. And we're going to get into just talking a little bit about it so you can understand that there is something out there that does house calls. So, Chris, why don't you introduce yourself, and then we'll let Rebecca introduce who you are.
Okay.
What company you have, and who you serve.
Okay. I'm Dr. Chris Edens. I'm an emergency medicine physician by trade.
Mm-hmm.
Got my training at Grady from 95 to 98 through Emory University. And I've done medical directorships in ERs for the vast majority of my career, starting in Cartersville, to Redmond, to Spalding, to Thomaston, Piedmont, Buckhead. I usually go in, take contracts that are off the rails, figure out what's wrong, be it throughput, be it providers, be it relations with administration, and get them back on the tracks. Right. 8 years ago, started GoMed, Mobile Urgent Care. That's the company's name. And it's exactly what it says. It is a mobile urgent care.
Wow. It gives me chills thinking about that. So, Rebecca, why don't you share what your role is and how our viewers can understand what you're doing with the company too.
Absolutely. So my name is Rebecca Sutton. I actually started clinically in Memorial Hospital in Chattanooga for 6 years as a clinical exercise physiologist with open heart surgery patients. Then I went into ER recruiting. I've been doing that for the past 15 years. Recently joined GoMed back at the beginning of September as the new director of marketing to really help grow the concept up here in the Marietta, Cobb, Kennesaw, and Ackworth area.
Awesome. And so at what point, I'm just curious, the conversations you were having, I'm sure you were used to a certain way. Now you're joining Chris in the business. So what was that like when you decided to leave a comfortable position to the not the unknown, but
yes. It's exciting.
Mm-hmm.
Yeah, it's exciting. I think it's a challenge, which I like. I've heard a lot about GoMed just through Chris and some of the people that work for him. So I think anything I can do to help grow the business. We're moving into a kind of a different time in our relationship now that Chris has cut back clinically on his ER shifts. So this is actually something that we get to do together, which is very cool and exciting.
That's good. Now I know when we were talking that you do have, both of you have a Georgia Bulldog background.
Yes.
So do you like to go to games?
Yes.
100%. Yes.
And Chris actually went there for school.
I did.
Well, you're definitely rooting for a pretty good team right now.
Yeah, so, they're putting it on.
Yes, and the Florida win was, I heard Dan Mullen say, "Hey, I think we got an upset coming." And I said, "Oh yeah, that's why you're announcing and not coaching, because just one person doesn't make a team." And I know that certainly. So let's get back to GoMed. So Chris, when you were thinking of the problems out there, what was the thought process in starting a company like GoMed?
Well, the thought process was that, everybody is about convenience. And it is very hard to get into your primary care physician. Typically, somebody calls it's days to weeks. And when they're sick, they want to be taken care of then. And that's where we fill in. And there's some other, concierge companies out there that take cash only. We take insurance.
Okay.
So, Medicare and most of all the other private payers are included. And we want people to be able to use their insurance. They pay, for their premiums, and we want them to be able to use that service that they have. So we began in Coweta and Fayette counties. I lived in Peachtree City at the time. And we grew organically through there. Grassroots, neighbors, friends, sports teams. And we built a reputation. And the folks that work in GoMed are emergency medicine trained. So chances are, if you went to the emergency room, you might see one of those people there. So why not? Let's bring them to the house. And we're completely mobile. We don't have a brick and mortar. We can go anywhere. We can go from your house. We can go to your business. We can go to the ballpark. And we have many great stories about taking care of parents while their kids are having tennis lessons,
Mhm.
instead of taking another, 30 minutes to 45 minutes out of their time somewhere else in the day while they're waiting, watching their kids. We take care of them. One guy was in a fishing tournament and cut his hand, and he pulled up to the bank, stitched up his hand, put him back in the tournament to finish up. So it's about convenience. There's a lot that we can do. We can do all of the point of care testing. So the COVID, the flu, the strep, the RSV. We can dip a urine to see if there's any infection or blood in the urine to treat urinary tract infections, or try to diagnose kidney stones. We can do lacerations, as I said. We can do INDs of abscesses. We can do breathing treatments. We can start IVs, give IV fluids for dehydration, nausea, vomiting. We can give medications through the IVs, Zofran for nausea, Decadron steroids for rashes or respiratory illnesses, antibiotics, and some pain medicines that we don't do narcotics, but we use Toradol for pain medications. So anything that you would go to an urgent care for, you can stay in your own home. So your waiting room is your living room.
Ooh, I like that one. That is a good one. Your waiting room is your living room. Okay, viewers, that's what you call convenience. So I always like to ask. We had the KSU Small Business Administration gentleman on earlier, and so he says that a lot of people think that he's mainly startups, but he's actually more for the more mature businesses. So at what point, like 8 years, there has to be different spurts of growth. What was like some of the challenges that you faced after like the third year? Because if you make it third, fourth, and fifth, it's usually like you have an established like concept. What are some of those challenges for our viewers that are business minded?
There's been some bumps in the road. Trust me, it's been some years of hard knocks. Coding and billing, electronic health record systems, EHRs. We've had some changes in those. The growth and able to afford that growth and to really capture a market. Those have been challenges. We have expanded into Charleston, South Carolina, and we're there. And growing that business as well. We started in Coweta and Fayette counties, like I said, and I've since moved to Cobb County. So we are now open in Cobb County.
Awesome. So how did you sell your wife on joining you in the business? So can you walk it through, like, what was it? What enticed her to quit a nice, I'm sure, nice, comfortable job to join you in the business? What did you say? I mean, what was like, because you got to be a pretty good salesperson.
Indeed. So the world of emergency medicine is very difficult.
Yeah.
COVID made it that much more difficult.
Mm-hmm.
The ERs are overwhelmed. All of the waiting rooms are full.
Mm-hmm.
The rooms are full of admitted patients waiting to get upstairs. Anybody who presents to emergency room, typically they're waiting, 3, 4, 5 hours sometimes to be seen. And there's got to be a better way to do this. Yeah. There's got to be a better way to deliver care. The physicians that work in emergency medicine, a lot of them, they're getting tired. They're burnt out. They're looking for that other way to do things. And I tell you, when the first time someone uses GoMed, and me or one of my providers walks into their home, first they're amazed because, how can a provider be coming to my home? Yeah. And then second, they're so thrilled and they'll tell their neighbors, and we have a 90% retention rate. So once we have a patient, they're ours forever. And we want to be that go-to, when they have an urgent care need, we want them to call us. We don't want to take them from their primary care physician. We want them to continue to follow up and, get all their normal tests done and their blood work and all of those things. But for those, hey, I'm sick today, that's when we want you to call them in.
Wow. I love that story. And I'll have to share with our viewers because I got to give a shout out to Betty, because not that you cut your finger making a particular, but she had this was about 5 months ago, 6 months ago. And they had her hand wrapped and you could see there was bleeding. And there was a nurse walking her by and I said, damn, Betty, what happened? She told me. And I said, well, what are you doing? Are you getting? And she told me, yeah, I got this Go Med and they're going to stitch it up. And I went, what? Coming into our building and walking into the building, obviously the nurse was walking to the room with her and they were going to do whatever needed to be done. And I thought, oh my gosh, that is the coolest concept. And I literally forgot about it until recently. I looked at the card and it said Go Med. I went, holy mackerel. Not only is it a great concept, great name, holy mackerel. So Chris, I'll ask Rebecca in just a second. How did you come up with that name?
Well, it's completely mobile. We have no brick and mortar.
Mhm.
So there's a lot of people will call and say, hey, we want to come see you. It's like, well, no, you stay where you are. We'll come see you.
Yeah.
So that's where the concept of Go Med came from. It allows us from a business aspect to be very lean.
Mhm.
There's not a lot of overhead cost in
Right.
maintaining a brick and mortar and all that goes with that. It also allows us to expand. So in order to expand into a new territory, it's about finding that right provider that has the right mindset and customer satisfaction skill set to take care of patients, and then going out into that community and growing that business and letting people know that it's there.
Oh, that's awesome. I like that. So tell me, like, Rebecca, with you taking on the role of the marketing, what was the biggest challenge in that transition, going from established routine to more assisting in the marketing efforts with Go Med? What did you find to be challenging?
I think just the lack of people that really know about it. So as soon as they find out and actually use it, they love it. But there's a vast majority of people right now, especially in this area, that just don't know about the concept. So my biggest focus has been physically getting out to places. Like I came here and you saw my business card here.
Right.
We're doing an event tomorrow. Really just trying to get people together. I think old-fashioned house call, old-fashioned marketing, where you're not just sending out emails to people introducing yourself, you're actually showing up, introducing yourself, telling them what we can do, giving them some advertising materials. So I think kind of going back to like grassroots marketing that maybe people aren't doing today kind of gives us that competitive edge.
Mm-hmm. No, I agree. I mean, it's amazing that when I was this downstairs, I go to the gym early and I'll just sometimes while I'm waiting for my coffee, I'll go over there and see if there anything's going on, because people will leave their business cards on the credenza. And it was like it was a magnet. When I saw that card, it brought back Betty's story and I went, holy mackerel.
Right.
There's the company behind it. Because she had said something like, I thought she said they're close by, but you don't have a brick and mortar. Is that what I'm understanding?
We do have a building across the street where we keep supplies, but it's very small. It's more like a closet than an actual physical office. So that our nurse practitioners and PAs in this area can come to that building, and we have a supply closet and they can get what they need to be able to go out and see patients. Okay,
that makes sense, because Betty pointed next door and I was like,
right across the road.
Really? Yeah. Okay. And so I never really had asked her after that, like, where next door, because she pointed next door.
Yeah.
And that makes sense.
And we have some of our cars that are wrapped with the Go Med
really?
Advertising up there as well.
Okay.
Yeah.
Gotcha.
We do have a call center. That call center is located in Peachtree City.
Okay.
And that's kind of the main hub.
Okay.
So that's the call center. That is the coding, billing, collections that relates to the company that goes through there. Management is there. So everything's out of one office there in Peachtree City.
Awesome. So when you're not working, what do you all like to do for fun and like recreation?
We love to work out.
Okay.
Yes, we try to work out. We did a spin class this morning and then a short boxing class. We like to lift weights.
Really? Boxing?
Yes.
Okay.
Yeah.
Well, you're punching the bag, not each other.
I'm glad you clarified that. I'm thinking like, okay, you should have a bruise somewhere. Yeah, okay, gotcha. Okay.
So that's fun. We like to go to Georgia games.
Yes.
Chris has 2 sons, so we try to take them to at least 1 game a year.
Okay.
As a family, so that's always fun.
Yes.
But,
Travel?
yeah, we do like to travel. We went
Okay.
to London with my father back in September for 10
Right.
days. I was born in London, so got to see
Okay.
a bunch of my family while we were there, which was really fun.
Nice.
Yeah, we like to scuba dive, snorkel, go to the beach.
So it's not all work. You
Correct.
do have a kind of
Yes.
a recreational balance. I love
We
that.
do.
I totally love it.
Yeah.
I have a buddy out of Houston, and he would always tell me, I'm going to spin class. And we never really got to why he loved that. What is a spin class?
So basically it's usually a 45-minute class where you walk into a room where there's a bunch of spin bikes set up, and you have an instructor who's usually at the front of the room instructing the class, really has good music, and you do a lot of interval training.
Mhm.
Where you speed up and go really fast on the bike, and then you'll slow down, and then you'll go really fast again. It's really good endurance training for the heart.
Okay.
And really does, get your blood pumping, get your blood pressure up, gets a lot of the fluids moving in your body, which is really good. And the great thing is we get older doing something like spin or water aerobics, it's less pain on your joints, basically.
Okay.
There's no impact to your joints, which is great, but it still allows you to be physically active, which we all need as we get older.
Yes. Yeah, that is one of the biggest challenges that I saw when I came in here is people don't necessarily embrace the active part of senior living.
Yes.
They getting out of your room and into either any kind of movement that gets you moving and socializing too. I mean, that's important
Yes.
too. But
it's essential as you get older, honestly. Chris sees a lot of patients that come into the ER, and sometimes they may be 70 or 80 years old, and he's like, wow, you look great. You look, 10, 20 years younger than what you actually are, just because you're physically able to move. You've got some muscle definition. You're not overweight. I wish more people would really try to make at least time for 20 or 30 minutes of exercise every day. It'll make you feel better.
yes, you're right about that. So let's talk about the boxing. That really captured my attention. So what's that like? You're using a punching bag, I
Yes.
guess. Okay.
Yeah, it's in a
So-
room set up
Okay.
with an instructor, and they
Okay.
have probably 20 bags hanging from the ceiling, and they have the boxing gloves for you.
Right.
And it's a 45-minute class. So basically you do rounds just like you would in a boxing ring.
Okay.
Where you're punching the bag and you're doing, uppercut, roundhouse, all the different boxing techniques that they have. And it's just really good. Again, it gets your heart pumping, gets you moving, which is great. And it's just fun. You do it with a bunch of other people. They have great music. Yeah.
So
And then they alternate the rounds. So some of the rounds are boxing rounds,
Yes.
where you're throwing jabs and uppercuts and
Okay.
body shots. Then other rounds, you're on the ground and you're doing core work. So you'll be doing sit-ups, or you'll be doing planks, or you'll be doing, some other little exercise. Then another one, then you'll go back to boxing. Then the next time they'll have you doing cardio. So you're doing jumping jacks and knee bends and different things like that. So they mix it up to keep the heart rate up. And then in between you get to, punch the bag and take out all those aggressions.
Man, it
Good
really
stress
is. Yes, exactly. And, I just, we had a concierge trash service that came in and they said, hey, we're going to make it easy for you to put your trash out. I'm saying, I'm not into easy, so I don't want it. So I told them, take it away. Then I'm carrying the bag and I didn't face plant, but I rib plant and knocked the air out of my, and I bruised the ribs pretty good.
Yeah.
And I understood after that why boxers go for the ribs.
Mm-hmm.
And I would always say, why don't you go for the knockout punch? But if you injure the ribs, those hands come down
because then you get a headshot.
Yes, exactly. And I totally understood exactly the strategy of like a Muhammad Ali when he would just pound away at those ribs and all those good boxers. had that strategy, and now I understand it. So boxing, is it like a company that you go to, or is it a gym that has
It's an
boxing?
actual gym. It's called Windy Hill Athletic Club, and it's
Okay.
right where it's 2 miles from where we live.
Okay.
So we frequent there. We try to, work out 5 or 6 times a week if we
Right.
can, just for 30 minutes to an hour, in between whatever we have going on that day.
I know exactly what you're talking about. I've done Alta tennis there.
Yes.
And
It's a
so,
big tennis
yes,
facility.
yeah, I know what
It's a
okay.
great gym with really good instructors.
And I guess it's a diversified
Yes.
of all different things.
It is. It's
Is the
3
spin
floors.
class there too?
Yes.
Oh.
So they have 2 pools, an indoor and an outdoor pool. Then the
Right.
second level, they have a lot of cardio equipment, weights, and that's where they do all the classes. And the 3rd floor, they have a walking run track at the top. So yeah.
And more bikes and more
Yeah.
Yeah.
ellipticals, things that are, low impact,
Right.
Yeah.
climbing steps, things like
And it
that.
caters to all age groups. You see kids there playing basketball, and
Right.
then you see 80-year-old people walking around the track.
Oh.
Yeah.
Well, I'd love for you to, we always ask at the end, like, do you know of guests that would, be very interesting for our viewers?
Sure.
And so I'd love to hear, because you hear the basic gyms and they have just certain amount of stuff, but
Yes.
that seems very diverse as far as the options that you have
It is.
under one roof.
Yeah.
That's
Absolutely.
good. Well, that's I want to say also, so in this area, Kennesaw, you have the option for people to get a hold of you. So how do they get a hold of you so our viewers would know?
844-99-GO-MED.
Okay, dang, if that isn't simple. And we'll put in the show notes. We'll put in there for.
Yeah, we're on Facebook as well. So you guys
Okay.
can look at our patient reviews, which we feel
Right.
speaks volumes about the company to others.
Yes.
And then we also have an app that you can download as well, the GoMed app.
Really?
So that makes it easy as well for scheduling appointments.
Oh my gosh.
So just
Yeah.
go on your Facebook, pull up GoMed Mobile Urgent Care,
Yes.
and you'll find it on there. And then you can look at, it tells about our services, it has an about, which tells about all the different people. And then it shows all of the reviews. And
Okay.
I could sit here all day and tell you how great I think this company is.
Right.
But those people saying it in their own experience, it speaks volumes for us.
Yes. I totally agree. I mean, before I was in reputation management. And so we would always say, let your clients, customers sing your praise, because they're the best ones, because they've had experience. And usually, like Betty had, I mean, you cut your hand. What are your options? Emergency room.
Right.
For hours, you'll wait.
Yeah, exactly.
With a cut hand, you'll be there.
Oh, you're there all day, and then you're around people coughing and,
Sicker
all.
than you are.
Yeah. And it's like, do I want to go to the emergency room or do I not?
Right.
And if you don't have any options, you're going to go that route. And you're right, Chris, when you say it's absolutely a bottleneck in the healthcare system is the ER room. So yeah, thank you for starting the company.
And
Yes.
if Betty happened to be at work, wrap it up.
Yes.
Keep doing your work. Call us. We'll come there, take you in the break room, wash it out, clean it up, stitch it up. You miss 10 minutes of work.
Yeah.
Wow.
We can go to, car auto dealerships, service centers,
Yep.
the park. It doesn't matter. We can go anywhere.
I mean, I have a lot of interesting people. I love people that solve a big problem. And I'm telling you what, you solved a big problem, because that ER, anybody that has had an ER experience in the last couple of years knows how difficult it is, because the ER, I think, I don't know if I'm correct in this, is like when it comes to our healthcare system, if you go into the ER, we have to treat people in the ER. You can't refuse them. Could you clarify that? I don't even know if that's true.
So there's a law called EMTALA.
Okay.
And what that states is anyone who shows up on a hospital campus requesting treatment has to receive a medical screening exam that should be done in a timely fashion.
Okay.
Now, after the medical screening exam, if they determine that the patient does not have an emergency, they can ask them to go see their primary care physician or pay in order to be seen. It's not used very often to that aspect. Pretty much if you show up, they're going to treat you. I mean, they're not going to turn you away.
Right.
You stay as long as you like, and we'll get to you when we can. And because there's so much risk, once you've established that doctor-patient relationship by doing a medical screening exam, your risk is there. So from a physician standpoint, I would rather follow through and treat that patient no matter how long that took.
That makes sense. And, I've never had it clarified like that. I always heard that, everybody funneled into the ER. That's why it's a bottleneck. And so that makes sense that that's the case. And so you solve the problem of the bottleneck by providing a mobile option of treating people in wherever they are.
Right.
So, yeah, that's awesome. And we always, as we close in, because I know we've got to make sure you're continuing to go out there and we could talk all day about this. And I know I could, because I just intrigued by solving big problems. So would you, I'm going to ask both of you just to give our viewers like a last insight, let's do it from a founder and then from a marketing perspective. So Chris, go ahead and give just a little insight for our viewers, and then we'll let Rebecca close with a little bit of her marketing insight.
For me, it was a breath of fresh air as a medical provider taking care of patients, to be able to go into someone's home and provide that level of medical care. People are just excited that you're there. You get to meet them, you get to know them, you get to meet their kids, their dogs, and sometimes even the neighbors. And it's just a great experience. Whereas in the ER, it's not always a great experience. If they've had to wait for hours, they're already upset by the time you get to them. So you're doing service recovery from minute one, when we could have delivered that care to their home. So that's the biggest thing for me as a founder and as a provider, that we are doing good work and taking great care of people.
I agree with you. So Rebecca, that's a tough one to follow, but we'll give you that.
Absolutely. Yeah. I think you could not ask for better quality providers. These guys are emergency medicine trained nurse practitioners and physician assistants. A lot of them have actually worked with Chris in the ER and with some of our other physicians. So we know what we're putting out there in the market. We trust these people. The comfort level that they give patients is incredible. The amount of reassurance that they're able to give people who a lot of times, sometimes just aren't well educated on whether they need to go to an urgent care or an ER. So the fact that these guys have been ER trained, they know immediately when they walk into the home, is this person someone that we can treat here today? Or is this someone that needs to go to the emergency room because they're really sick? So that level of expertise, that is being provided to these patients, it's just unmatched. I think nobody else is really doing that with the high level of education and quality care that these guys have. So at GoMed, taking care of you is what we do. So that's what we like to say.
Wow.
So let us come out here and take great care of you and your family and loved ones.
That's so comforting. I'll just say one thing. The house call was at least 50 years ago for me. And it was up in Asheville, North Carolina. We had a doctor who actually made house calls 50 years ago. I don't know at what point it went away, but it's a long time ago.
Cycles, right?
It's back.
Yeah.
It's coming back full circle from where our grandparents used to have a physician that came to the house.
Yes, it is so refreshing. And we want to thank y'all for coming to Overture and being able to educate our viewers on what options are out there. Now you can't say you don't know about GoMed. Right. You have to say, hey, look, now I understand it and why it's a great option.
Yes.
So thank you both for being a guest on Kennesaw Happening.
Thank you for inviting us. We
Yes, sir.
appreciate it.
Thank you so much.